Hey, happy Friday, everybody. I'm coming on much later than I normally do, but I've been having so much to think about since last night. I've really had the issue of money on my mind. I think it started when I was listening to the Chancellor of the United Kingdom talking about financial support for people who are in difficulty, for people who maybe are self-employed and or who have lost their means of livelihood. And he said they were going to give help, but the money would be given in June and it'll be backdated till March. And I was just thinking, okay, so what are they going to do between now and June? How are they going to live? I know they always say to us that we should have 6 months savings as emergency money. But can any one of you tell me how many of you have 6 months of your income saved up somewhere as emergency or contingency money? Not many people are able to put away that amount of money. So I'm sure that probably people have started to struggle or people will start to struggle soon. So I'm thinking this is now the time to start to think about money, because not only, I'm a doctor, yes, but health is also wealth, and wealth is health. You know, if you are faced with not being able to pay your mortgage or not being able to buy normal things for the house, I think it will affect your mental health, and it can then affect your overall health. So I think it's important that we talk about money in this sort of daily chat. What I'm thinking, if you all agree with me, is that maybe we'll make Friday like the business day. And I've come on later because I was thinking, oh, how can I add value to you as you're watching? How can this be of use to you? Because yes, the health bit we talk about. What about the money bit? So I've been running around since this morning trying to get someone, a financial expert, to come on and just to help. But I haven't been able to get anyone. But I have a few people lined up, and hopefully maybe next week we'll have someone to be able to help. But I will share what I have looked at, particularly for the UK, and also tell you what's available out there for people to look at. I'm sure most of you already know, but I will still share it with you. So just what Vine Health is about, it's all about you being healthy and wealthy and strong. And during this pandemic period, because this is such a difficult time for everyone, and this is only our first week of the lockdown, that you all become really much stronger after this, and that we're able to count our blessings, that I'm able to share anything I learn with you, and that you're able to share with me as well. So anyway, I'll save this after I finish, and you can watch it in your own time. I know it's a bit later than I normally would come on. So yes, breaking news is that the Prime Minister of the United Kingdom, Boris Johnson, has just tested positive for coronavirus. I did think he was looking a bit, washed out last week when he was doing the daily updates live. He did look a little bit unwell. So yes, he's positive for it, and he's being said to be recovering and to be doing okay, and the illness is mild for him, which is a good thing. But again, every single person that has caught this virus, my heart goes out to you, and I pray that you have a swift recovery. Just recover quickly, and our hearts are with you. Since I last came on, again, the death toll keeps on increasing. England has gone up to 584, which is quite a lot, a big jump from the day before. And similar in the United States. Nigeria is now 65, but still only have one death, which makes you think 65 cases only has been found, only one death. Now, is it because we're not testing? Is it because the weather is not conducive to the virus? Because really, in the United Kingdom, flu season, when you have the virus season goes down in the summer. But there have been other countries that are warm and have had coronavirus there as well. So if you have any theory as to why there's only 65 cases in Nigeria, no deaths, we're very happy about that. However, is there a problem in the system? Is that why we're not diagnosing people? Or is it the fact that we are just not getting it because of our location and how close we are to the equator? Somebody needs to tell me about that. So Nigeria has remained quite low. In the United States, it's really getting really bad, and the death toll is over 1,000. Again, watching the President of the United States speak just always breaks my heart. I know he's desperate for the economy to recover, but the health of the people must be first. There's no way that country can be open over Easter. So today I want to really talk about the finances of this whole situation and the difficulty of business. I'm not a financial expert, so I'm a doctor, but I really do believe that people deserve to know what's out there. And I'm sorry if I say anything that is not quite right for the financial experts out there. Please just correct me. But yesterday, there was over 3.3 million people claimed for support in the United States, the highest highest unemployment rate so far. That's a real problem. And obviously, they've also agreed to have a stimulus package to help the country, which is a really good thing. And that's the right track to go on. Now, in the United Kingdom, the government has pledged to pay 80% of people's salaries, for the next 3 months, but that will be capped at £2,500. And I'll paste the links here for those who have not seen it, but I'm sure most of you have seen it already. There's also, between now and when they pay the money, I think the money for the self-employed people will be paid in June and backdated till March. But between now and then, for anybody who's struggling immediately, they can have some universal credit. But again, I heard that the queue for universal credit, there was 130,000 people trying to get on to get some help for that. That must be soul destroying. And for anybody who's struggling out there, I'm so sorry to hear that. And if there's any information that I can bring, I will bring that to you. Now, what about Nigeria? There's no financial support for anyone. In fact, I categorically heard the state government say that there was no financial support, that you should forfeit your income for 7 days of the lockdown. But I'm also aware that there's a lot of money being given to Nigeria to fight the coronavirus. Hundreds and hundreds of millions of dollars. So what is that money for? It's important to know, because I'm sure if you're also using that money to support unemployed people or people who have lost their income, that is part of fighting this pandemic. I know that Lagos got 10 billion naira from the federal government to fight the coronavirus pandemic. So please, everyone, let's just help each other. Let's make sure that we are actually helping people, and people in Nigeria who are losing any income over this should actually challenge the government, because there is money being pumped into the country to help fight the coronavirus pandemic, and that money should be accounted for. That money should not really be given to people to take home. It shouldn't go into their pockets. It should be accounted for. So I would say that there clearly is money in Nigeria, and people should be able to get access to that if they are struggling because of this current period. So today is the Money Friday, as I said, money day. So any questions about money, I'll pass it on to experts who couldn't be on here today. I'll post on there the links for the UK for how you can go and apply for any support. And if anybody knows any other ways of supporting people, because we all need support at this time and we all need to come together. Health-wise, I hope you're all keeping strong and you're all keeping safe. If you are struggling with your health or your mental health in any way, please reach out and send a question to me, and I'll be more than happy to answer it. For all the people that are sending WhatsApp messages about the remedy for coronavirus, please stop sending this out. You will have lives in your hands if you keep sending out all these remedies. I got one today, which I can read out about the coronavirus remedy today, and someone said, tips from patients who have overcome coronavirus: lemon and lime, garlic, ginger, honey, apple cider, boil a cup of water and add 2 spoons into it, 3 tablets of vitamin C every 6 hours. Buy from a so-called place, Bitter Cola and Syncoma. Please stop sending these messages around. That is not a cure for coronavirus, and you will end up hurting people. I've received loads of those messages, which are like broadcast messages to people about the cure for coronavirus. That's not the cure. Let's just stay strong and hope that this pandemic passes miraculously. Let's do our own part. Stay indoors, stay at home. Do your 1 exercise a day. So I've been out already to go for my run. And tomorrow will be Wellness Saturday. Before, if anybody knows, I used to do this 10,000 steps Saturday. So I will still do my 10,000 steps. But if you're not able to go out and you want me to show you a few just simple exercises, I may just be brave enough to stay in my gym kit and show you something like a wall sit or a plank, which are the most effective exercises to do and will give you also overall health. And remember to eat healthy. In fact, somebody said to me that they were craving and they were eating a lot because they were at home. The cure for craving is exercise. I tell you, if you're able to just get your heart rate pumping, you will crave less. Boredom just gets you going with food and a lot of sort of bad food. When you're tired, when you're bored, you're going to crave even more. Please try and keep healthy. Reduce your sugar intake. Increase your vegetable intake. If you must snack on fruit. If you want to have a sweet or sugar, maybe have it once every other day and in small amounts, and then do as much exercise and drink lots of water. Have your nice clear skin. Drink lots of water. Now, if you want to partner with us, reach out to me. We have our supplements line. Go on to www.vinehealth.org if you want to have a look at that. If you want to see our previous videos, we have a new YouTube site. The first person to sign up might even get a little gift from me. We've only just put up the site about 2 days ago, our YouTube channel. So please sign up to that as well. Thank you for listening today. I know I came on a bit later. I appreciate you listening. For those who have shared my videos, thank you. For those who have not, what are you waiting for? And many of you are my friends. Please share the video, support the effort. This is done with no profit in mind. It's done just because I feel that we need to all share with each other. And as we give, we will receive. Let's give so that we can receive. Have a wonderful Friday. Enjoy your time with your family, and I will see you tomorrow.